Hello everyone, welcome to Field Notes, an exploration of functional medicine. I'm Rob Downey, a family practice MD and Institute for Functional Medicine certified practitioner. I'm coming to you from Seaworthy Functional Medicine in Homer, Alaska. Seaworthy exists to help people overcome their health challenges and be fully vital. Today we are fortunate enough to be joined by Holly McClure, a physical therapist and an expert in BioSynchronistics. Thanks for joining us, Holly.
Thank you so much for having me. Appreciate the opportunity.
Oh, well, I'm very excited, and I know you're a busy lady, so it's good of you to create the time.
Absolutely, happy to. Grateful for the invitation.
So I'll try to summarize your bio, but make sure and add anything that I might miss, if you would.
Sure.
So you're a physical therapist, and you got your certification and training in Texas. You've been in Alaska for many years, providing physical therapy here, and for around 10 of those years, you've been doing BioSynchronistics, which, as I've been getting up to speed on it emerged out of physical therapy, but it's some really specific body work that's very helpful to folks in profound ways. And as we prepared for today's podcast, we talked about its similarities to functional medicine, and part of, I think, the joy and fun of today's interview will be getting into some parallels I've identified even as we got ready for this. So is that an accurate synopsis of your bio? Are there things we should add at the beginning?
That's very accurate, yeah. And then, when we spoke the other day, there's a lot of parallels between how you and I both kind of view the body's healing mechanism, being in a very holistic way. And BioSynchronistics provides that from a structural standpoint. And yeah, I've been here for 15 years and doing BioSynchronistics for about 10 and learning something new from it every day, all the time. It's always evolving. It's exciting stuff.
Well, maybe what will help our audience will be that spoiler alert's a bad thing in a movie or a book, but it's probably a good thing in a podcast. We'll be concluding, I think, with talking again about the body knows the way, and we're helping the body do what it knows how to do and needs to do. And so with that framework for today's interview, let's start with your own personal experience with BioSynchronistics, because it's been
Sure.
part of your personal journey, and it's got some parallels to the genesis of it, right? The founder.
Yes, definitely. Definitely. Yeah. And I think that's really common, in practitioners like yourself and myself, that our personal journeys kind of lead us on to what we're meant to do. And that's the case with my personal story. So I, at around the age of 9 or 10 as a child, I was experiencing some pretty intense back pain. It would keep me awake at night, and I would complain to my parents about it, and it was just kind of a puzzling thing. My uncle's a chiropractor. I went to chiropractors, and over the years just never really found significant relief. And I think that it's a huge reason why I pursued physical therapy later in life, was sort of a way to absorb as much information as I could to understand why the body feels pain, and develop tools and techniques to hopefully heal myself during the process. I grew up as a pretty tomboyish kind of kid, jumping off roofs and doing crazy things, and then went into athletics in high school, and loved pushing my body to the breaking point, just seeing what it could do. And I've always been active and, kind of pushed through pain, discomfort along the way, not really realizing that, my body was holding on to those things that were happening to it. So I pursued the career of physical therapy in hopes that, one, that I would learn how to explain what I was experiencing, but also what to do about it. And help others, of course, that are like me, that aren't responding to kind of conventional or traditional type of approaches. Because what I found was that there was kind of a snowball effect, like, I would hurt this or injure that, and I would think I'm past it, and then something else. And there's like this trickle effect of the body really just breaking down. And that was my experience. And so when I got out of PT school, I graduated out of Texas Tech University, and the first job that I took was in Anchorage, working for an orthopedic clinic. And it was about 7 years into my career that I thought, I'll be lucky to get 10 years of, out of my body doing this kind of physical work. I couldn't stand long enough to range somebody's post-operative shoulder for 10 minutes without just feeling intense pain. I couldn't sit long enough to, do intake paperwork with a client. And then, using my body in a way to help their bodies heal, it's a very physical job. And so it was really quite frustrating and discouraging at that time. And I was also kind of losing faith in my profession. Like, here I am, like, I'm supposed to have all the answers, 7 years of school, 7 years of practicing, and I still haven't found that thing to unlock this healing mechanism in my body. And so I saw a lot of different types of practitioners all around Anchorage, chiropractors and other PTs and massage therapists. And, I was kind of just that person that got passed around because the techniques that typically work weren't working. And I was, things were just getting worse. And I eventually met someone from Sturbridge, Massachusetts, who said, you need to learn about this technique called BioSynchronistics. And, I was kind of intrigued, but also thinking it's just some other thing that's not going to work, I'm sure, that was the pattern that had been repeated throughout. But I went home, I got on the computer, I contacted the BioSynchronistics Institute, emailed them, we exchanged some information back and forth, and I ended up flying out there and taking their courses, and worked closely with Carol Sherpke, who was one of the ladies that developed it, along with Cheryl Wilbur. And after about 2 weeks of her treating me, I not only noticed that some of these very chronic issues were resolving, but I could actually feel the transformation happening in my body, that I was able to move in a different way, hold my body in a different way that was new and unfamiliar. And it was just a profound experience for me. And from that point on, I've just submerged myself in it. I've done several internships with Carol back at her clinic in Sturbridge. I have helped her teach multiple courses over the years, and it's changed my life. It's changed my life as a clinician and a professional, and then obviously my personal journey. I'm so grateful to have found it, and now it's restored my passion for what I do, which I really had lost there for a long time. So, yeah, that's my story.
Wonderful.
Yeah.
Well, I'm sure our listeners want to know, and I thank them for joining us on today's journey. So what is it and how does it work? Do you want to describe you as a recipient or you as a provider? And this ties into one of the questions we felt would be high yield for today, which is what should people expect if they participate?
So, the definition of biosynchronicistics, you could say, is a light touch fascial release technique that uses gravity and physics to balance the body. But I think the best way is maybe to give an example or a case study. So kind of like the one that we talked about the day that we sat down. One that has always stood out to me was during an internship in Massachusetts with Carol. And she had a gentleman come in who was an avid cyclist, and he spent hours and hours on his bike, and he was experiencing neck pain, especially with looking up. And he, just was in there because he had heard about BioSynchronistics and had tried other things. And so we took a look at him, and as we watched him attempt to look up, his eyes looked up, but there wasn't much movement from his neck. It was pretty clear that there was a huge restriction in his mobility. And upon further evaluation, as a biosynchronistics practitioner, you're looking at the structure, head to toe, and you're looking at it in a gravity situation, because we all live under the force of gravity, right? So looking at him standing, there was a significant anterior pull coming from his lower abdomen and hip flexors, which was, tipping his pelvis. And so when he tried to look up, there was no room to do so. And, so we took a 10-minute light touch fascial release technique to his lower abdomen and hip flexor area, which allowed his pelvis position to improve, and it restored his range of motion immediately. And one of the greatest things about biosynchronicistics is that the changes are happening in real time. You're not saying to this client, okay, here's what I need you to do. I need to stretch your pecs every day, and I need you to lay on this foam roller so that you get some thoracic extension every day. And, 8 to 12 weeks from now, I think you're going to have your range of motion back in your neck. That's kind of the traditional way, to treat and to look at it. It's a lot more fun and a lot easier to just be able to find that source of where the dysfunction's coming from, treat that, and then the body will do the rest. The body knows how to heal itself when you can provide that balance for it. And so that's an example of how, biosynchronicistics looks at the body through this framework.
Great. And as I was looking into it, I was seeing references in workplace safety, references from big organizations or sort of clearinghouses for best practices for workplace ergonomics and safety. Also seeing prep for people who take the course, sort of encouraged to go back and dust off their anatomy and kinesiology from their physical therapy training days, which is very common in functional medicine, as many of us who got training as medical providers broke our brains on the Krebs cycle, the energy production cycle, and then we think we are forever put it behind us, right? And we go back and get IFM certification. It's like, okay, here's the Krebs cycle. You just go, oh.
Absolutely.
Then they teach us, well, we're gonna make you fall in love with it, because we're gonna teach you how to wield this tool that you had these assumptions what it means, but there's a beauty and an elegance when it has immediacy in its application. So I think that as I've been looking into biosynchronicistics, one of the things that really stands out to me as super important and not necessarily intuitive is these fascial networks and fascial planes that are everywhere in the body. And I think, myself included, people have either no knowledge or they have a little knowledge to the extent of, when I see a little bit of fascia on the trimmings of something I bought from the store, or when I clean a moose or a deer or an elk, I see the fascia in there, or I see it on the chicken. And then another one will be, the presumption that somebody who does a type of body work where they treat these things as knots and kind of attack them, that the fascia needs to be attacked. And so I think an important thing for us to do today is to hear from an expert like you, what's going on with these fascial planes? Why would they become sort of crumpled or adhered? And the either super intuitive or non-intuitive part, how can they be unkinked in a session?
Well, good question. So the fascial network of connective tissue is very intricate. It's three-dimensional. It's not linear as in, muscle fibers are. So therefore it doesn't stretch. And if you think about our base of support, we're upright beings and our base of support is quite small. And there's a lot that can go awry in our structural, and kinetic chain. And the body has to recruit something to stabilize itself, right? Or will kind of crumple or fall over. So one of the ways that it does that is by increasing muscle tension. Okay. And so that will temporarily stabilize something, but over time, it can't sustain it. And that's when you'll start to get fascial adhesions, which again is just the body trying to meet the demands that you're placing on it. But it's kind of too much of a good thing because, as time goes on, and again, we've got, the ground reaction force pushing up and we've got gravity pushing us down. If we've got some kind of twist or turn, that's progressive over time, if not dealt with. So, a fascial adhesion somewhere is going to lead to a fascial adhesion elsewhere. And before you know it, we're totally restricted. So viewing it from that standpoint, the body's trying to do something good for us. But these adhesions create pain and dysfunction and abnormal movement patterns. And the problem with going directly at them with a direct technique like trigger point or, those types of things is that a lot of times, it just doesn't work. Now, if it's truly a restriction just in the tissue, some of those techniques are effective. But if the body has stabilized itself with that adhesion, it doesn't matter what you do or how much force you use, the body will not let go of it because it needs it. So, for example, let's say you have like an athlete that comes in and says, I've got these really tight hamstrings and no matter what I do, I just can't I can't get them to let go. I've tried stretching, I've tried rolfing, I've tried dry needling, all these techniques that are painful and go directly at that tissue. And nothing changes. And, every time I do a deadlift, I throw my back out because my hamstrings just won't give. Right. So,
right.
If you look at, okay, well, ask the question, body, what are you doing? Like, why are you holding on to the hamstring so tightly? The body's stabilizing something that's pulling its center of mass forward. Right. So if the hamstrings let go, the tower falls over. So until you can identify and go at the restriction in the front body, those hamstrings can't let go, no matter what you do. And so you're just basically putting your body through a bunch of unnecessary discomfort, and prolonging the issue. And in some cases, I do feel like a lot of those direct techniques, when it's a stability factor for the body, make it worse. But if you go at the source, which could be like an abdominal surgery or, something that's pulling the body forward, if you release that and then balance the body out in a standing position, the client's going to come back and go, my hamstrings let go. And I actually didn't even really need to stretch them, but I tried and my stretches actually felt effective for the first time, and so that's kind of.
That's so cool. There's so much I'm intrigued by about that. So one of the challenges of getting to be the fortunate steward of a podcast is sometimes I'll think about 4 things I'm super interested in as I get to talk to a thought leader. And so one of the things I think might be most interesting to our audience is what is it about the technique then during the treatment that allows the fascia to reset? So if you use that same vignette that you've been sharing with us, what does somebody who's trained like you, can you describe what you do?
Sure. In this scenario, I would get the person in a position where that tissue's on slack. So I would maybe have them sit or have them lie down with their legs elevated so that the area that I want to let go is soft and relaxed. And then you go into the restriction of the tissue. So rather than like trying to stretch it and pull it in the opposite direction or knead it in the opposite direction, you actually go into it. And, you know, it's definitely a skill that's developed over time to be able to feel what the tissue needs. But what you're doing is you're essentially compressing the tissue to put it on slack, or, you know, the Chinese finger traps. You remember those little Chinese finger traps? It's like you put your fingers in them, and the harder you pull, the tighter they get. You're like, how do I get out of here? You got to go into it, right? Go into it and put it all on slack. And then the body goes, I don't need it. And it just lets it go. And you get this crazy release that is like, I mean, I've been on the receiving end, and it's just as fascinating on the facilitating end of it to feel, like, literally feel injuries leaving the body.
Yeah.
And so it's all about putting the tissue on slack and waiting and pausing until the body realizes that it can heal and let go of that restriction.
Thanks so much. This is great.
Yeah.
I love getting to learn about this, and I know the people who listen will love getting to learn about it. So I wanted to flag a couple of parallels to functional medicine and see what you think about them. One is that when I do functional medicine as an IFM certified practitioner, it's a secondary certification I've received in addition to being a certified and licensed family practice MD. And for you, you're a certified and licensed physical therapist, and then you're doing the BioSynchronistics as part of that. And so to me, that reveals part of what's happening and why it's working, because you're working from your primary mastery set in a secondary adjunct mastery set. They're sort of like Russian nesting dolls, but it's important that that primary mastery is there, because the understanding how the body works and being a physical therapist and what exercise does and what stretching does, that's kind of the 101, I would think, for the 201 of BioSynchronistics.
Absolutely. Yeah, I would agree with that for sure. You know, that's BioSynchronistics is a framework. It's just a shift in perspective on how to treat the body in a much more effective way, but drawing on all the science and all the, PTs, most of us are pretty detail oriented, and we're scientists, and, we like to analyze and that's kind of, what's really fun about learning about the body and all the intricacies. And so that's definitely, at the core. But BioSynchronistics is just taking all of that knowledge and background and information and applying it from a new perspective and framework.
Well, I would think also then any of us whose primary training solved everyone's problems, we wouldn't necessarily have an impetus to do more. So a lot of us, that curiosity and that drive to serve those who suffer, particularly those who get stuck, I can honestly reflect in this moment, that's been the drive for me, is that I've seen the folks who are so frustrated in conventional medicine settings, feeling like I'm doing my part, I'm doing everything I've been asked to do, I'm doing everything that's been identified in conventional medicine, and this is affecting my job, my relationship, my potential, my sleep, my energy, you name it, my ability to even, a lot of people say, I can't even put food in my stomach without my body rebelling. What am I supposed to do about that? And so when I see in functional medicine, many people get unstuck, that's the storytelling part of the intense desire to keep doing it.
Right. Yeah.
The other day that in addition to one for today's podcast, just where you see these folks get unstuck and get moving, that's a big deal to them, and that's been a big part of what's generated your BioSynchronistics practice to date, is that iterates itself, because then the word gets around that there's a specific value to what you do and how you do it. Is that accurate?
Right. Yeah. And I like you using that, term unstuck, because it really, like, you just feel stuck, like nothing's working, nothing's clicking, things are breaking down. And it's just about unlocking, that healing mechanism that the body inherently has. But sometimes it just needs just a little bit of facilitation or guidance along the way, to bring it back in balance, very similarly to what you do for your clients, just from a different standpoint. I'm looking more structural, but there is a trickle effect of the healing mechanism once you unlock it. If you imagine someone who's, got these fascial adhesions everywhere, and so their posture is incredibly poor, and they have to sit at a desk all day, and they can't get up and move, and it's very fatiguing to be in that body. So once you can, get them unstuck, unlock the mechanism, allow the body to heal, their energy improves, their blood flow improves when they're not stuck. So many things start to heal when you unlock that mechanism of healing. So
yeah. I wanted to get a chance today, in preparing for today's interview, to talk about some dimensions of that. So one was that the theme emerging in functional medicine over the last 5 to 10 years, as I witnessed not just my practice, but thought leaders, is that sometimes it's super powerful and helpful to work the brain-body connection backwards. So to have the body have a watershed breakthrough eases the brain, and I can conjecture about what's happening. A lot of the science is saying that the midbrain and the stress distress or fight, flight, freeze centers, even with a brief hiatus from stress distress, or because the body is saying, hey, there's been a big change down here. Rejoice.
Let's run with it.
Rejoice, everyone. There's been a big change on the front of the body.
Yeah.
It's hard to overstate how much that respite can cascade then down to these stress distress centers I've grown to think of like a cat stuck in a tree, to say, okay, I'll come down and have a bowl of milk tonight.
Yeah.
I'm getting out of the
absolutely.
tree. I'm gonna give that a try. And so sometimes the benefits are these cascades of healing, and that's a different way to work. And it's showing up again and again in people with fight, flight, freeze, many of whom don't know that they have it. When a victory happens in another dimension, it can free them up.
Yeah, absolutely. There's, the structural is just one part of it, but as you probably encounter in your practice as well, our emotions are tied into the tightness that we carry, the restraint that we put on our body. And so, there's always emotional healing that takes place when you free the body of that burden. And it's just really fun to watch and to see and to be a part of.
Neat. Well, what do you advise people when they get that release? What homework do they end up with, or do they not end up with homework because they're released and they get back in action? Are they prone to re-adhesing? How does all of that work?
It depends, but in general, when you can provide the body a better balance point, it will do whatever it can to maintain it. So a lot of times people are like, well, how am I not just going to go back? Like, because when I went to Rolfing or chiropractic or whatever, like, it only lasts for so long, and then it's back. But it's because you're working with gravity and because you're always providing the body a better balance point. Things don't go back, but there is, I have a fun example of when there is definitely a lot of patient education involved to not revert back to bad habits or bad repetitive positions and things like that predisposed them to where they are. So when I was just a couple years into BioSynchronistics and was excited and fascinated about it, I had someone come into the clinic, and when I looked at her, I was like, her entire trunk was rotated like 90 degrees off of her pelvis. And she told me that she's a student. And I thought, what does your computer station look like? Like, are you sitting to the side? Like, are you totally twisting your body towards your computer? Like, are you on the couch with it on a side table or something? Because the way that you're stuck in this position is crazy. And she said, no, I don't do that, and I kept probing. And she's like, no, like, I don't do that. And so I'm like, okay, we went on with the session and I treated her, and I'm still like digging, like, how did she, get like this? She comes back a week later and she says, I think I figured out what you were talking about. She said, ever since I was a teenager, I would sit on my vanity and turn towards the mirror to put my makeup on. So she's side sitting on a vanity to be right up to her mirror, turned 90 degrees looking towards it. So of course, in that case, I'm going to, recommend that she stop doing that. Let's set up a better way, so, there's times where there's a lot of education involved, like, habitual things like that, ergonomic and body mechanics. Sometimes you do need to retrain the brain. But a lot of it is just about giving the body another choice, like when the body's stuck, it has one option, and that's to be stuck. But when you unstick it, it then at least has a choice. And some people do need a little bit of guidance on, okay, you've been moving this certain way all this time because you had to, but you don't have to move that way anymore. Can you feel how your body can move this way? And then giving them very simple, realistic exercises to kind of break that brain body pattern that they've been in for so long.
So interesting. It's so cool.
Yeah, it's so cool.
So let me flag a couple of potential parallels and see what you think about these. So one is the body knows the way. And I want to talk about how profound that is in functional medicine, because the same thing happens. People will say to me, well, geez, Downey, you're talking about a restoration of native vitality. You're talking about getting back on track and staying back on track, not combating just symptoms or signs. And that's sort of alien to a lot of Westerners and a lot of Americans. And so one of my messages is that the disease focus of conventional medicine has a real problem that it creates. It starts to create an underlying perception that we're just these bundles of predispositions to disease that we're fated to start stumbling into every decade. And that the fight is like in Greek mythology, be fighting the Hydra. It's got 7 heads when you start, and you cut one off and it sprouts 2. Cut one off and it sprouts 2. And the Institute for Functional Medicine completely flips that, because that's what the brilliance of naturopathic medicine, and the two are closely related in their roots. It says the body knows the way. If you provide enough support and you get enough obstructions out of the way, then the body knows what to do. And once I've seen that in practice, then it's been very humbling, because I'll realize the body's doing millions of things right. There are a few obstructions, a few needs for what I think of as what's called trophic support. The same way we'd water a plant, we need trophic support to clear the obstructions. And then the body can do that. Even to the degree now, we're seeing that people with neurodegenerative diseases, if we provide enough trophic support for multiple sclerosis or early pre-Alzheimer's, and get enough obstructions out of the way, whether it's silent inflammation or prediabetes, what have you, these folks are having a restoration to their native cognition. So it's humbling, I think, but beautiful for Americans and Westerners to know that we have this gift of our body. And if we can do things harmoniously that allow it to do its thing, then we get to be along for the ride. That's just so different in so many ways.
Yes, very similar. BioSynchronistics puts the powers all in the body, and people sometimes will say, like, you have magic hands, or like, I don't know what you're doing, but, you're amazing. And I always give it back. No, this is your body doing this. Like, I'm just following along. Like, it's leading me, it's guiding me. I'm just following it, and that's the same, literally when I get a release, I follow it and the body leads me, to release it. And that can be really hard for people. I always try to encourage them to bring me feedback. Your body will talk to you between now and the next time I see you. Bring me all of that feedback. Tell me what your body's saying to you, because it will tell you, it will let you know what our next step is in this process. And it's really hard for people to do that, because especially with chronic pain, they have conditioned themselves as a survival mechanism to not pay attention to what's happening in their body. And maybe even they're angry with their body or resentful, and they don't have that appreciation for it that is necessary. But it's really fun to watch that process change, as they start to realize, what's happening and how the body's healing. And then they'll start to pick up on those little cues that they're getting. And they'll start reporting in between visits, like, oh, I noticed that, like, my heel is just striking the ground differently than it ever has. And, or something like that. And it's like, thank you. Like, let's keep digging. Let's keep asking the body, like, what's our next move here? I rely on that a lot. There's a couple of clinicians from Carol's clinic in Massachusetts, and one of them is just totally visual. She just looks at the body, watches the person walk. She's got her treatment plan for that day. And there's, another lady who, she can't see it. It doesn't matter if she takes a gait video and slows it down. She's got to feel it. She puts her hands on the body. She can feel the direction that the tissue's pulling her. She's got her treatment plan for that day. I'm like 50-50 between like visual and tactile, but I'm also like heavily reliant on what the patient's reporting to me, what their body's telling them. And the combination of those three things is how I kind of formulate my plan. But so much of it is up to the body, because like you said, the body does know the way. Like, we just need to get out of its way.
Very helpful information. So you mentioned pain, and I can think of lots of people that could benefit, but am I hearing you accurately? This is a good choice for people with chronic pain. Who are some folks that, hearing the podcast, could have that aha moment? Oh my gosh, BioSynchronistics could be a watershed moment for me.
Fibromyalgia, MS. A lot of my clients who have MS, they come in and they say, my doctor's been telling me for a while that I need physical therapy because I fall often, my balance is poor, and I have these constant spasms all the time. But when I exercise, everything gets worse. And they come thinking that I'm going to have them exercise, And then when I do this hands-on treatment that takes tension away and balances their body, and their gait changes and their center of gravity shifts, and then they're sort of blown away that, like, some of those symptoms of MS can actually be targeted and be helped with this technique. And it's painless. It feels good too. It feels good to receive it. It's a pain-free technique, even with MS and fibromyalgia. So those types of chronic pain, they're very responsive to BioSynchronistics. And for a lot of them, it's the only tool that's, really helped them.
And I presume from our talk today that people with these musculoskeletal puzzles, either people that just want to work this way because it makes sense to them, or because, again, they're stuck, other modalities aren't working, whether it's old muscle issues, unhappy joints, difficulty getting good posture, tight hamstrings, what have you.
Yes, things. All of those things, just the earmarks of modern life, and, sitting at a desk all day, or, whatever it may be, or history of trauma as a child, like tailbone falls and head injuries, those things, that's a significant amount of compression for the body to absorb, and it carries it with it moving forward. So yes. And I love working with pregnancy. I work really closely with Dr. Ostrom, and that is probably my most fun to do, because what greater gravitational shift than pregnancy,
Yeah.
right?
Yeah.
I mean, right around like 20 weeks or so, when the baby is big enough that it comes out of the pelvis, immediately most women start to experience some type of painful symptom, some strain or some tightness in low back and sciatica and hips and this and that. And it's progressive again, because the gravitational shift is going nowhere but more forward.
Yeah.
And so it's really, really, really fun for me to work with the prenatal clients, and give the baby room too, because if we balance the pelvis and shift the center of gravity backwards, baby has all this room. And I've been able to assist in allowing a baby to turn from a breech position just by creating room in the pelvis of the mother, and so it's just so fun.
Yeah. Neat.
Yeah.
Well, you're now Alaska PT and Wellness, and
Yes.
you've got a cash pay model. So what should folks know about that and why you chose to do that?
I chose it for a lot of reasons, honestly. I can charge a much lower rate because I don't have the overhead of billing insurance and hiring employees to battle with them to get payment. And so people pay me up front for their visits, and they get a super bill electronically through my documentation and scheduling program that they can submit themselves, and their insurance will reimburse them directly or apply it to their deductible. So it's a much more affordable way for people who either don't have insurance or have high deductibles. But a lot of people, it's a very reasonable rate, and a lot of people just pay cash because they don't want to mess with the insurance side of things either. But it's available to them if they choose to do so. So and it's going to open up, personally for me, a lot more time with my family, just to be able to, control my own schedule. And I just love what I do, and I don't really like being under insurance regulations guiding me and restricting me in what I do. I've worked in clinics where we've gone in network with insurance, and it sounds really good as a client to be like, oh, you're in network with my insurance. Well, that's definitely what I want. But we have to authorize visits, and they give us 6, and then we hit that limit and we ask for more. And, I just want to make people better and be able to practice the way that I want. And that's why the cash practice model fits what I do best.
Well, those are really interesting dimensions of what you're sharing. And I think it's a big deal in Alaska because people have so many Alaskans have to really attend to where their resources are going. And that's a blessing when it's within reach. For a lot of Alaskans I take care of, that's the difference between whether they're going to get help or not. That's just the reality.
Definitely. And in a clinic setting, a lot of times people will get to a point where they reach their physical therapy goals. So, they're fully functioning, and we've restored their range of motion and their strength and this and that. But they want to keep coming because they love it and they value it, and they see it as a wellness, a part of wellness, which, as you and I know, like insurance doesn't necessarily put a whole lot of value in that. And there needs to be an option for people to receive services they want on a wellness basis without insurance saying, no, we're not paying for that, because you've met your goals. We're cutting you off. You can't do that.
Yeah.
So
yeah, absolutely.
Yeah.
Well, talking today reminds me of my business coach and mentor, Dan Kalish, down in California. So he's been part of functional medicine for 30 years, and he's the one that taught me the business model for South Peninsula Hospital Functional Medicine to become seaworthy functional medicine and serve people around the state and things like that. And I have these memorable moments from taking his class because he'd be in San Francisco, and all of us around the country, we had a scheduled day time each week. We'd all show up, all 20 or 30 of us, and get to listen and learn from him. And he said, in a world without money, he would wake up every day and do the same thing. That him doing functional medicine and teaching people how to do functional medicine is exactly what he would do with his life. And I feel like that's a really powerful place to come from. And I get the feeling talking to you today, that's where you're coming
that
from.
resonates with me. Yeah, that resonates with me for sure.
Well, anything you want to add, Holly, that we didn't get to today?
You know, it's been wonderful. I think that we've hopefully been able to hit the main topics of, you know, biosynchronicistics and what it can do. And so, yeah, this has been really such a blessing. Thank you.
Yeah. Thanks again for your time and insight and for helping people.
Yeah. Thank you. And same to you as well.
Thanks. Have a good rest of your afternoon.
Yes, you too.
Seaworthy exists for people to overcome their health challenges and be fully vital. Please consider subscribing, giving us a 5-star review if we've earned it, and going to our website podcast tab for any questions or comments you'd like to share with us. Thanks.